There are other kind of impartial groups who have done literature reviews of the existing science on this, and so I just want to go through a couple of those. You can get all the kind of footnotes and documentation in the book. You can feel free to take pictures of the slides. The first is from a literature review in 2004, and so I'm going to go from 2004 up until the present day. But this was The Guardian. I think the UK paper, The Guardian, the weekend edition asked Birmingham University's Aggressive Research Intelligence Facility to assess the findings of more than 100 follow-up studies. And so this is what The Guardian reported in its paper. ARIF, which conducts reviews of healthcare treatments for the NHS, concludes that none of the studies provides conclusive evidence that gender reassignment is beneficial for patients. It found that most results were poorly designed, which skewed the results in favor of physically changing sex. There was no evaluation of whether other treatments, such as long-term counseling, might help transsexuals, or whether their gender confusion might lessen over time. So that was in 2004. 10 years later, so 4 years ago, in 2014, Hayes Incorporation did a literature review. Hayes is a consulting firm that hospitals and health insurance companies use to evaluate new medical technologies and whether or not they should provide them at their hospital, whether or not they should cover them on their healthcare plan. And so this is what Hayes concluded 4 years ago. Statistically significant improvements have not been consistently demonstrated by multiple studies for most outcomes. Evidence regarding quality of life and function in male to female adults was very sparse. Evidence for less comprehensive measures of well-being in adult recipients of cross-sex hormone therapy was directly applicable to gender dysphoria patients, but was sparse or conflicting. The study designs do not permit conclusions of causality, and studies generally had weaknesses associated with study execution as well. There are potentially long-term safety risks, but none have been proven or conclusively ruled out. In other words, it's all experimental. And yet you'll see the headlines, including today, there was a new meta-analysis of studies that I believe researchers at Cornell University just released today, saying that there's a consensus, an overwhelming consensus of thousands of studies that show that sex reassignment benefits patients. Where did that come from? This is what impartial researchers summarize it. Maybe you're going to say that the Guardian from the United Kingdom or Hayes Incorporation are biased. So would you trust the Obama administration? Because it said the same thing in 2016. So first I'm going to show you the proposed decision memo that the Center for Medicare and Medicaid Services put out in June of 2016, and then I'll show you the final decision memo. Based on a thorough review of the clinical evidence available at this time, there's not enough evidence to determine whether gender reassignment surgery improves health outcomes for Medicare beneficiaries. There were conflicting, inconsistent study results. Of the best designed studies, some reported benefits while others reported harms. The quality and strength of evidence were low due to the mostly observational study designs, with no comparison groups, potential confounding, and small sample sizes. Many studies that reported positive outcomes were exploratory type studies with no confirmatory follow-up. So the studies that the media likes to hype that show the positive outcomes, those are the ones that are low in quality due to the observational to study designs with no comparison groups, the potential confounding of causal factors, small sample sizes, and that many of them are self-reported outcomes with no confirmation. And so 2 years ago, the Obama administration was willing to admit these are the flaws within the research. And yet now you will see that the media has decided that there's a consensus, and that if you don't agree with the new consensus, you suffer from a phobia, transphobia in this case. Then you can see the final decision memo, which came out in August, repeating overall the quality and strength of evidence were low, with no comparison groups, subjective endpoints, potential confounding, small sample size, lack of validated assessments tool, and considerable loss to follow-up. And unfortunately, that last phrase there refers to some people who have taken their own lives. They've been lost to follow-up. Then, and this one I want to skip ahead just again in the interest of time, but here you'll see about halfway through it, they'll say, after careful assessment, we identified 6 studies that could provide useful information. Then they say, of these, the 4 best designed and conducted studies that assessed quality of life before and after surgery using validated psychometric studies did not demonstrate clinically significant changes or differences in test results after gender reassignment surgery. So we have patients coming to us who are suffering, and the hormonal and surgical procedures that we are giving them do not have any clinically significant changes after all of this. So then why are we doing it to their bodies? And then in the last slide from the Obama administration, it points to that same, oh, it didn't advance. Nope, it went too far. Here we go. It points to that same study that Dr. McHugh pointed to from Sweden, where it identifies the mortality was primarily due to completed suicides, 19.1-fold greater than in control Swedes. But then it also points to neoplasm, cardiovascular disease, which more than doubled, and then other forms. And then notice what it says in the middle, that the mortality rate increase didn't materialize until 10 years after the surgery. So many of these studies that the media likes to tout that only reports the satisfaction of the patient a year or 2 or 3 after the procedure, they're not looking at the long-term consequences. Which again, in August of 2016, the Obama Center for Medicare and Medicare was willing to point out that the best study design showed that these suicide rates start manifesting themselves 10 years out. That's all with adults. What can we say about children? First, as I mentioned earlier, puberty-blocking drugs as a treatment for gender dysphoria is not FDA approved. It wasn't tested for this purpose. It wasn't approved for this purpose, which is to say that it's entirely experimental. There's not a single long-term study on the long-term consequences of indefinitely blocking puberty in a child. They have no idea what the long-term physical consequences are when it comes to bone density and bone length and growth, and musculature, organ development. Think of all of the changes that take place to a human body at puberty, and think what it would mean if you didn't go through those changes. And they're changes that take place not in isolation, but in a coordinated, integrated way. So they have no idea what the physical consequences are. They also don't know what the psychological consequences are. Second thing about this is that they claim it's, quote, fully reversible. But that's an Orwellian abuse of language. Even if they're right, and it's an if, even if they're right that when you stop taking puberty-blocking drugs at age 16, normal puberty could recommence. That doesn't reverse the 6 years that you blocked puberty. Right? Hoping that it'll recommence later in life doesn't reverse the damage that may have been caused by blocking it. And so they're telling parents, don't worry, it's fully reversible. But for developmental biology, not going through a developmental process when you're supposed to isn't reversed by going through it several years after the fact. And then lastly, many physicians fear that it's a self-fulfilling protocol, that encouraging that 5-year-old boy to wear a dress and to go by a female name and pronoun, and then blocking puberty in that 10-year-old boy, and then giving estrogen to the 15-year-old boy may very well be reinforcing the transgender identity. I mentioned at the very beginning of the lecture that 80 to 95% of young people who experience a gender identity conflict will naturally grow out of it. The study by the Dutch doctors that pioneered this puberty blocking technique, 100% of the children placed on puberty blocking drugs persisted in their transgender identification. Now they claim that they were able to accurately identify who the real transgender children were, and they only blocked puberty in those children. Other physicians, what they fear is that it's precisely the rush of testosterone that the 10, 11, 12, 13-year-old boy would be undergoing when he goes through puberty in his boy's body that may help him get out of a gender-conflicted stage and to consolidate his identity and unite it with his body. And so you may actually be blocking one of the developmental mechanisms that help us consolidate our gender identity in the first place. Again, they don't know because it's entirely experimental.